So we are discussing about history taking in respiratory medicine. We have discussed cough and expectorant. Now let us discuss hemoptysis. What is hemoptysis? Hemoptysis is coughing out blood. Coughing out blood is called hemoptysis. So blood coming in the mouth can be from different source. It can be from nasopharynx, it can be from tracheobronchial trees and lungs, or it can come from gastrointestinal tract, that is the upper GI bleed. So it is important to differentiate hematemesis and hemoptysis. Hematemesis is blood coming out from gastrointestinal tract, that is the source of the blood may be from esophagus, from stomach, or from duodenum, the upper gastrointestinal tract, or hematemesis and hemoptysis. So hemoptysis is coughing out blood and hematemesis is blood vomiting. Blood vomiting. So sometimes the patient might not actually know where the blood is coming from and simply complain to us that blood is coming in the mouth. So the source of the blood may be from nasopharynx, from the lungs and tracheobronchial trees, or it can be from gastrointestinal tract. So we have to ask a specific question to know whether or what is the source of the blood or where it is actually coming from. So what we have to ask is, in hematemesis, if blood coming in the mouth is coming from gastrointestinal tract, that is vomiting blood, or hematemesis, it is usually mixed with vomitus or the food particle. The food particle or the gastric content in the stomach is usually mixed with blood. And if the blood is mixed with the food particle or the gastric content, it usually suggests as hematemesis. And if the blood is mixed with sputum, it usually suggests that the blood is coming from tracheobronchial tree or from the lungs. Hematemesis usually follows nausea. As there is nauseating feeling before vomiting, the person might complain us that there is nausea, and after nausea there is blood coming in the mouth. So it usually suggests us hematemesis. Nauseating feeling before vomiting or nauseating feeling before blood comes in the mouth usually suggests us hematemesis. And if the person coughs, if the person is coughing, it follows hemoptysis follows cough. If the person coughs and after that blood comes in the mouth, it usually suggests that blood is coming from tracheobronchial tree or from lungs. The color of the blood. The color of the blood in hematemesis is dark brown. Why the color of the blood in hematemesis is dark brown? Because we all know when we check for hemoglobin in hemoglobin estimation in physiology laboratory, we usually turn the blood into acid hematine. We mix acid and the blood turns into acid hematine and the color of the blood becomes dark brown. So it same happens in the gastric content. When the blood is mixed with HCl in gastric content, it turns into acid hematine and color of acid hematine is dark brown. So if blood is coming from the gastrointestinal tract, it is usually mixed with acid and the blood turns dark brown because of formation of acid hematine. In hematemesis, it is dark brown, and in hemoptysis, it is usually fresh red blood. Fresh red blood. When we look for the pH of the blood coming in the mouth, and if the blood is acidic, it usually suggests that blood is mixed with acid from the gastric content, and it usually suggests hematemesis. So blood in hematemesis is acidic because it mixed with the gastric content. The acidic gastric content in hemoptysis is the normal pH of the blood, that is alkaline. Normal, or it can be the normal pH, that is alkaline. The blood Coming in the mouth, if it is frothy, it usually suggests hemoptysis because it is mixed with air. As the lungs is continuously pumping in and out air, so blood will be mixed with air and it is frothy in case of hemoptysis and not so in case of hematemesis. So the amount of the blood, if less than 20 ml of blood is coughed out in 24 hours, if less than 20 ml of blood is coughed out in 24 hours, it is usually mild hemoptysis. And if more than 150 ml per episode, if more than 150 ml of blood per episode, or more than 500 ml in 24 hours is coughed out, it is usually massive hemoptysis. It is usually massive hemoptysis. It is usually massive hemoptysis. And massive hemoptysis is a medical emergency. The person might go into hemorrhagic shock at any moment. So what can cause hemoptysis? Simple disease like bronchitis to a deadly disease like bronchogenic carcinoma, anything can cause hemoptysis. It is important for us to differentiate what is the actual cause of the hemoptysis. First, we have to differentiate whether it is hematemesis or whether it is hemoptysis. Once we have differentiated in history that it is hemoptysis, the second important point is to differentiate between the various causes of the hemoptysis, like that from simple cause like acute bronchitis to a very deadly cause like bronchogenic carcinoma, anything can cause hemoptysis. So in bronchitis, in acute bronchitis, the hemoptysis is usually a small amount of blood with sputum, small amount of blood with sputum production. In bronchogenic carcinoma, the blood is usually frank red blood. Bronchiectasis can also produce hemoptysis. But hemoptysis in bronchiectasis is usually associated with large amount of sputum. As we have already discussed in sputum, in history taking in sputum, that bronchiectasis produces a large amount of sputum. In pulmonary tuberculosis, there may be streaks of blood with sputum. Streaks of blood means thread-like blood is attached with sputum, is known as streaks of blood with sputum. There may be other features of pulmonary tuberculosis like that of cough, chronic cough, fever, night sweat, weight loss. So it will help us differentiate between various causes of hemoptysis. In bronchogenic carcinoma, usually there will be history of weight loss, chronic cough, hemoptysis along with hemoptysis. In acute bronchitis, there will be short history. There will be small amount of blood with sputum production. There will be no features of chronicity of the disease. In bronchiectasis, there will be feature of chronicity of the disease associated with large amount of sputum production. Good pasture syndrome is a rare disease. Good pasture syndrome is a rare disease which can cause hemoptysis. It is usually anti-basement membrane antibody. It is usually because of formation of anti-basement membrane antibody. So this anti-basement membrane antibody destroys or disrupts the basement membrane in the lungs as well as in the kidney. So it causes hemoptysis and hematuria. So good posture syndrome causes hemoptysis, and if the person is coming with hemoptysis along with hematuria, we must think of good posture syndrome, that is the anti-basement membrane antibody formation. The cardiovascular cause, some disease of the cardiac system can also produce hemoptysis, like that of mitral stenosis and acute left ventricular failure. We'll discuss in cardiology series that why mitral stenosis and acute left ventricular failure, and how and what is the mechanism by which it produces hemoptysis. Pulmonary embolism. Pulmonary embolism can produce hemoptysis, but there will be sudden history of sudden episode. Patient was apparently normal, then there will be sudden episode of small volume of blood, small volume of hemoptysis, and it will be associated with severe chest pain, severe chest pain, severe chest pain, and breathlessness. There will be history of breathlessness, severe chest pain, and small amount of blood, a small amount of hemoptysis. So it will usually suggest as pulmonary embolism. Thus we know that there must be a precipitating factor for pulmonary embolism to occur, like that of deep venous thrombosis. If the person is prolonged bedridden person, there is no mobility, there will be stasis of blood in the lower limb, which can form thrombus, and this thrombus can dislodge from the lower limb and can reach the pulmonary circulation and cause pulmonary embolism, sudden obstruction of the pulmonary vessel, so it can produce hemoptysis. So there will be features of breathlessness if there is sudden obstruction of the pulmonary vessel. There will be features of chest pain. Chest pain is because if there is sudden obstruction of the pulmonary vessel, there will be ischemia of the right ventricle. There will be ischemia of the right ventricle because the right ventricle cannot pump in blood to the lungs because of increased pressure, because of pulmonary embolism, and there is reduced oxygen supply to the ventricle because there is no ventilation perfusion occurring in the lung because of pulmonary embolism. Blood is not reaching the lung, so there will be reduced or there will be hypoxia, there will be increased pressure, right ventricular pressure, so it can cause right ventricular ischemia, and pain may be like that of angina in pulmonary embolism.